We have a bit of a smaller group today. Can you all hear me?
Yes, we can hear you.
I can hear you.
Can you all hear me?
Yeah, we can hear you.
Okay, my volume was down, sorry. Okay, is everyone ready to go?
We're ready, Matt.
Okay, I'm looking at 4 black boxes here, so I will start. I don't have, we're doing this midweek, going into the holidays. We don't have the weekly surveillance report to guide us. I can give you some summary of where we are. We're continuing to see a really high number of cases. We're continuing to work through those cases. I would note that we got some additional guidance from the Centers for Disease Control this week that really is a reflection of what we've been experiencing here for a number of weeks now, related to contact tracing and helping local health departments prioritize and think through how to do contact tracing in a bit different way. That guidance actually was somewhat validating for what we've been doing out of necessity more than anything, just because of the high number of cases. And that is really focusing on those cases that have been diagnosed recently and really focusing on people who tend to be in high risk demographic groups or tend to be interacting in high risk settings, like nursing homes or hospitals or any settings where you're coming in contact with people who might have more serious illness. We're continuing to see significant number of people hospitalized. It fluctuates pretty significantly from 1 hour to the next, but typically between 25 and 34 people inpatient have been admitted to the hospital. Earlier in the week, what it was looking like about a third, maybe 30% of those people were in critical care. Unfortunately, but not surprisingly, that has having more people hospitalized, having the higher number of cases has led to more hospitalizations, and that's led to us having to report additional deaths this week. I think we've reported 5 on Monday and Tuesday. Later on today, we'll be issuing, if we haven't already, a press release, one more death. That one is a male in his 60s who died at the hospital last week. So that brings to 6 the number that we reported just at the midpoint of the week. That's very concerning, but again, it shouldn't be surprising. It's what we've been talking about for months, what we've been trying to avoid for months. As of this morning in our morning huddle with contact tracers, I think I counted 27, upwards of 25 schools, K-12 schools that had active cases right now. We have 10 long-term care facilities, at least 10 long-term care facilities with active cases, and most of those have multiple cases associated with them. We're also seeing cases related to home health agencies and congregate settings, you name it. And I'm sure people are experiencing that in their own personal life too. As you go through, you're just probably running into more people who have been diagnosed. It's just spreading pretty rapidly in the community. We're continuing to do everything we can to get in touch with the people who are diagnosed, to identify close contacts who are in those sensitive age groups. We're also doing everything we can to manage our testing system, and to be somewhat protective of that, because that's being stretched, and we're continuing to see delays in our testing system that make everything harder. There is good news in the vaccine front in terms of the effectiveness, the apparent effectiveness of the vaccine. And that's promising and that's encouraging, and it gives everybody a little bit of lift in their step. I would caution everybody that this is going to take patience, that even if we do start getting doses of vaccine next month, this is going to be a huge challenge, and people need to be patient, and they need to understand that we're going to be in this for several more months to come. The vaccine, depending on which variety is used, is the transportation, the storage, and the distribution challenges are enormous. And that work is going to be done by a public health system and a healthcare system that's been running to past capacity for about 9 months now. So while we're planning on that and we're encouraged by that, we need everybody to really understand that is going to be a long process. That is not going to be like turning on a light switch. It's going to be like a light on a dimmer that comes up very slowly, because there's going to be challenges in terms of supply, distribution, and just whether or not we have people able to administer the vaccine is going to be challenging. The same people who are providing care and running test sites and doing contact tracing, those are the people we're going to rely on to help us organize and distribute vaccine if and when it arrives. And so it makes it even more important that people understand that while that's promising, it's not a good reason to be less careful than we have been. In fact, it's even more reason to double down on the safeguards that we have all been trying to put in place, keeping our distance, wearing face coverings when we can't keep distance from others, washing our hands, staying home when we're sick, and just treating ourselves as though we might be transmitting the virus, even if we're feeling great, because you might be. Those things are going to be really important, and it's going to really help determine how many more cases we have, how many more hospitalizations we have, how many more deaths we have from now until the summer, when we get to a point where we have plentiful vaccine supply and we're able to just provide it to anybody who wants it this spring and summer. So with that, I'm happy to answer any questions you all have.
Hey Matt, it's Perrin from the Chronicle. Just a logistical question. Will you guys still be releasing the report on Friday, or will you not be doing that?
Yeah, we'll put it up on the website, Perrin. I've talked to our staff who's doing that, and we'll get it out to you.
Perfect. And then this week, it looks like, obviously it's only Wednesday, but I guess through the weekend to now, it looks like the 7-day rolling average of cases has dropped kind of for the first time in a long time. Why, I guess, are you still seeing cause for concern in how cases are going right now?
Well, it's still remarkably high. It's good that it's not going up anymore, but we need several more weeks, and we need to see it not just plateau, but start to come down. As a reminder, Harvard University School of Public Health has really identified as a tipping point 25 cases per 100,000 people. We're at 4 or 5 times that, maybe more than that. You can do the math. So we have a long way to go before we get to the point where we can really be confident that things are de-escalating. We have a lot of winter yet to go. And what we're seeing with hospitalizations, cases are one thing, but hospitalizations are important. Death numbers are important. Case positivity is important. So while I'd rather see it, plateauing or going slightly down than going up, I'm just going to be pretty cautious about jumping to any conclusions about that.
Thanks.
Other questions?
Hey, Matt, this is Emma with NBC Montana. Can you hear me?
I can.
Okay, cool. So just two things. First, I know you talked about the hospitalizations a little bit. I know that's also something that changes really rapidly from day to day, even from hour to hour. But I think it's, if I'm not wrong, I think it's 34 hospitalizations today, and that's close to being our highest, I believe. So is there any concern there that this is going to start to be an issue since we're already having some staffing challenges with the hospitals?
Yeah, we've had concern for a long time. I mean, for months and months, we've had concern about that. I wouldn't say that's acute right now, that concern. It is significant. We checked this morning, and we just checked before this call. I think the number had come back down in the 20s. It's a pretty volatile number. It goes up and down. But your point is 34 cases is more than we've ever, 34 people in the hospital is more than we've ever had. That's pretty concerning. And it's a really good reminder of why we want people to stay, keep it small this Thanksgiving. Stay with those people that you're with in your household, or that are inside your bubble. Really keep it small. And I would really advise anybody who's over the age of 60, anybody who has, health conditions that make them more vulnerable, to really find a way to just limit it to their household. It's really a good reminder that the best way we can really help the hospital and help keep people out of the hospital is by everybody doing their part to keep it small and keep it contained this holiday season.
So second question, actually kind of coming off of what you just said about going into the holidays and the importance of keeping it small for tomorrow, for Thanksgiving. Obviously, we have Thanksgiving, a few weeks after that, Christmas, Hanukkah, then New Year's. Is the health department expecting a hard next 2 months with all of the holiday season?
I think public health in general has been expecting a pretty hard beginning of the winter for quite some time. That's what gives me some pause about looking at drawing too much confidence from the slight leveling off in our 7-day rolling average, because we know what we have ahead of us. It's not just tomorrow. It's what happens on Black Friday. And, if people go out and pack into stores, if it's what happens, with Christmas parties that companies have and other we have to find ways not to do those things. That is really what we need from the community, and we need people to do it for themselves. We need people to do it for others as well.
Great, thank you.
I would encourage people to be imaginative, and even I've had the occasion today to talk to somebody who just recently lost a loved one, and I was humbled by that person's ability and grace and ability to find a way to express gratitude. And I think we all need to do that. And, so as we move through the holiday season, finding imaginative ways to protect ourselves and to protect our family members doesn't mean you can't do your shopping, but do it online, do curbside pickup. It doesn't mean you can't, splurge and have a meal from a restaurant, but maybe think about doing it carry out, doing it delivery. Think about ways to do things that really minimize our contact with others, consolidate our trips to the stores, those kinds of things. It's going to be really important as we move through December and January. Other questions?
Hey, Matt, it's Taryn again. I just wanted to ask, outside of the initial letters that you sent to, I think, 2 businesses regarding violations of the more recent health rules, have you had any issues with businesses since then? And kind of how is, I guess, compliance looking at this point now that we're like a few weeks after those were implemented?
I mean, as I've said in the past, I want to acknowledge the vast majority of businesses that are finding a way to comply, including most restaurants and most bars. We do have a couple of non-compliant businesses that got warning letters. We're continuing to work with the county attorney, and those issues aren't over. We're pretty determined to find a path to compliance for all businesses and all organizations. And so that, stay tuned, that's going to continue to be a priority of the Board of Health and the Health Department. It's concerning to me that, you know, as we go through the pandemic and we have rising number of hospitalizations and we're announcing more deaths, we continue to have challenges with a small number of businesses. And, you know, we had a complaint this week of a business that was hosting a beer pong tournament, and it's just not appropriate. It's unsafe, and it's concerning. It's a small number. We're not seeing a significant amount of non-compliance, but, you know, we're going to take seriously when we do see cases of non-compliance and follow through on those. Other questions?
Matt, I have another question. This is Perrin again. I was wondering how, if at all, the health department is working with Big Sky on their surveillance testing.
Thank you for asking that question. So they reached out to us very early in the pandemic, and we've been communicating with them. I had a meeting with them, I believe it was Monday, where they really walked us through what their plans were. It was important to them that they had our support and our buy-in for how they're doing it. And it was important to me, a couple things that were really important to me. One was that whatever happens, whatever testing is happening in a broad way like that, it needs to be reliable testing, and it needs to be connected and reporting to our larger public health system. So when we get results, those results are being reported to the state health department and then being assigned to counties, whether that's Gallatin County or Madison County in the case of Big Sky, or somewhere else maybe. And they've heard that, and that I'm confident that that's built into their system. The other thing I think it's important to know about that effort is that it's a separate standalone testing effort that won't impact the testing system that we have ongoing in Gallatin County. And what I mean by that is the test sites that are being run by Bozeman Health and MSU and Urgent Cares, those aren't the test sites that are going to be used. They have found a way to pay for additional testing capacity that will be additive to what we're doing in Gallatin County. And they're even going so far as to hire some contact tracers so that it helps us respond to positive tests when we get them. So in general, they've been very communicative, and I've been encouraged by the fact that it's being done in a way that connects to the public health system and adds to our capacity rather than detracts from it or creates challenges for our existing system. I'm pretty confident that's not going to happen right now. Other questions?
I'll just take a second to remind you guys that the health department is closed tomorrow and Friday, and our dashboard will not be updated those days either. So just keep that in mind when you're reporting in the next couple of days. And help send people to our website if you can. Thanks.
So, hey, Perrin, I know you asked the question about Friday. Let me double check that we're going to have the capacity to get that report out on Friday. There's a chance we might do it on Monday, but I'll ask Whitney to just put out an email to you guys to let you know. where we're going to go on that. I'm pretty sure we're going to be able to do that on Friday. But I want to make sure before I commit totally. I'll have Whitney send out an email later on today. Okay, are there other questions? All right, folks, I hope you have a restful and a pleasant holiday. Keep it small, and we'll talk to you soon, I suppose. Thanks.
Thanks, Matt.